Ahoy, veterans! There's a big secret that almost no one is telling you about. One that could put up to $185 back in your pocket every single month. While the VA and Medicare talk about what they cover, they're never telling you how to get more benefits and refunds. And today, I'm going to break it all down for you. For those of you who don't know me, I'm Chris Duncan, certified Medicare insurance planner and retirement income certified professional. I've been specializing in Medicare for nearly 20 years, and we only work with veterans here. Medicare makes it so all of our services are 100% free to you. There are critical benefits and money-saving opportunities for Medicare and TRICARE that have never been communicated to you. Don't just take my word for it. Check out our real stories from our veterans that we have helped. The link to our testimonials is in the description. What they're not telling you is that with the right Medicare Part C plan, you can get substantial refunds on your Medicare Part B premium every month, plus extra benefits like comprehensive dental, vision, and hearing coverage, all while your TRICARE for Life continues working exactly as it should, paying all of your deductibles, copays, and coinsurance for your medical needs. But here's the real kicker. Most veterans have no idea this option exists because general Medicare advisors who don't specialize in working with veterans only don't understand the unique way TRICARE for Life works with Part C plans. My father, a Vietnam-era veteran, gets $150 of his $185 Medicare Part B premium refunded monthly through his Part C plan. That's $1,800 a year back in his pocket. His Part C plan also provides dental, vision, hearing, a gym membership, and more, all with a $0 premium because he's already earned it through his years of paying into Medicare. Do you remember all the money deducted from your FICA box on your paychecks? That was for you to fund your Social Security and Medicare. Today, I will reveal exactly what the VA, Social Security, and most Medicare advisors aren't telling you about how TRICARE for Life and Part C can work together to maximize your benefits while putting real money back in your pocket every month. This information can save you thousands of dollars a year. This information can help you make informed healthcare coverage decisions and save you thousands of dollars. Understanding these options is valuable for every veteran with TRICARE for Life. The real question is, why isn't anyone telling veterans about this opportunity to get Medicare Part B premium refunds while keeping all their TRICARE for Life benefits? The answer is simple, but troubling. Most Medicare advisors don't understand how TRICARE for Life works with Part C. They sell Medicare plans to everyone, veterans, civilians, it doesn't matter to them. They just don't have the expertise in military healthcare benefits. Think about it this way. When you have a serious health issue, you don't just go to any doctor, right? If you need heart surgery, you wouldn't go to a podiatrist who specializes in feet. If you need shoulder surgery, you wouldn't see a neurologist who specializes in the brain, and you certainly wouldn't want a general practitioner performing a specialized operation. Medicare for veterans, it's exactly the same. A general Medicare advisor who works with everybody is like a general practitioner in medicine. They know a little about everything but aren't deeply specialized in one area. On the other hand, we're like specialized surgeons of the Medicare world. We only work with veterans. We understand the complex interactions between Medicare, TRICARE for Life, and VA health benefits because that's our entire focus, not just a small part of our business. Just like you wouldn't trust a foot doctor to perform your heart surgery, why would you trust a general Medicare advisor to handle the specialized complexities of veteran benefits? The stakes are too high. We're talking about thousands of dollars in potential refunds and benefits that most advisors don't even know exist for veterans. Our expertise is built on thousands of hours working exclusively with veterans like you. That's the difference between a generalist and a specialist. You wouldn't go to a generalist doctor if you needed surgery, so why trust a generalist with your Medicare benefits? We specialize in helping veterans, period. That's all. That's what we do. That is all we do. When you have TRICARE for Life, you're required to have at least Medicare Part A and B. That means you must pay that $185 monthly Part B premium. But here's the key insight that changes everything. Uncle Sam doesn't care who pays him for the Part B, just as long as Uncle Sam gets his money. Think about this. The government requires that $185 payment every month, but the government doesn't specify that it has to come directly from your pocket. It's like when you go to a restaurant with friends. The restaurant doesn't care which person at the table pays the bill, as long as someone does. This is exactly how Part C premium refunds work. When you join certain Part C plans, the plan agrees to pay a portion of the Part B premium on your behalf. The government still gets the full $185 that they require. It's just that some of that money comes from you and some comes from your Part C plan. Uncle Sam is satisfied because he received his full payment. Let me break this down with real numbers. Let's say you join a Part C plan that offers a $110 monthly Part B premium refund. The $185 premium still gets paid to Uncle Sam, but now $110 of it comes from your Part C plan and only $75 comes from you. Medicare gets the same amount either way, but you're keeping an extra $110 in your pocket every month. This arrangement is completely legitimate and fully authorized by Medicare. Part C plans can afford to do this because they receive funding from Medicare. Some plans choose to use part of that funding to help pay your Part B premium. It's not a trick or a loophole. It's simply a different way of distributing the cost of Medicare coverage that benefits you directly. And the best part, you still keep all your TRICARE for Life benefits working exactly as they should, paying all of those deductibles, copays, and coinsurances. The Medicare Part C plans have contracts with Medicare to do this. It's on page 11 of the Medicare U Handbook. Some plans may have a $0 premium and may help pay all or part of your Part B premium. Let me give you a concrete example. We speak with veterans all day, every day, who are paying or are about to start paying the complete $185 monthly for Medicare Part B. And nowhere are they ever informed about the refunds available for Part C plans specifically designed for veterans. None of the mail being sent to you about Medicare is specifically for veterans. All of the mail is coming from generalists. Some Part C plans are made specifically for veterans. They have a $0 monthly premium. They are $0 because you have earned the right to enroll in them. And you have qualified for Medicare because of the tens of thousands of dollars that you have contributed to Medicare your whole working life. When you join a Part C plan, Uncle Sam sends the Part C plan money every month on your behalf. If a person makes an average of $50,000 annually for 40 years, then about $58,000 has been contributed to Medicare on their behalf. Our average client with TRICARE for Life gets a $110 monthly refund of their Medicare Part B premium. These plans can include dental, vision, hearing, and gym memberships as well, all at $0 monthly premiums. The Part C plans can do this because Uncle Sam funds them to do this. One kicker with these Part C plans is they all have different benefits. Some have minimal benefits, and some have a lot of benefits. Because we don't work for Medicare or the Part C plans, that enables us to be objective in finding the Part C plan with the highest refunds for you and the highest extra benefits. The Medicare rules also allow us to provide all of our expertise and services free of charge to veterans. You never pay us a dime. Medicare rules also ensure the plans are the same whether you use our free service or try to do it yourself. There are no advantages to becoming a specialist at this and doing it yourself. TRICARE for Life is secondary insurance. It pays second. It is straightforward how this works. When you go to a doctor, hospital, or other provider, the Part C plan pays most of the bill as the primary, and TRICARE for Life comes in as the secondary insurance you earned for the service you provided to me and our country. Veterans are shocked that no one has ever told them about these options. It is straightforward. To learn about the possibilities and how they work, you must work and spend thousands of hours absorbing all of the knowledge. Your VSO doesn't specialize in Medicare. Those who work at the VA do not specialize in this area. Your next door neighbor, unless your next door neighbor happens to be me, is not a specialist in veterans and Medicare, and your doctor isn't a specialist. Your doctor is focused on being the best possible doctor that they can be. I don't want a doctor specializing in Medicare insurance. I want to go to a doctor who specializes in being a doctor. To understand why certain Part C plans work so well with TRICARE for Life, you need to understand precisely how these two programs are supposed to coordinate. Let's start with the basics. When you turn 65 and have 20 years of service or otherwise qualify for TRICARE, your TRICARE coverage converts from TRICARE Prime or Select to TRICARE for Life. At this point, Medicare becomes your primary insurance and TRICARE for Life becomes secondary. This means Medicare pays first for Medicare covered services, and then TRICARE for Life steps in and pays the remaining costs, your deductibles, copays, and coinsurance. You should have virtually no out-of-pocket costs for covered medical services. And the only reason I say virtually is because there always seems to be some damn $100 aspirin the hospital says that we need to pay for. Now, here's where it gets interesting. Most veterans know they need Medicare Parts A and B for TRICARE for Life to work, but they don't realize you can add a Medicare Part C plan and TRICARE for Life will still work as secondary coverage. When a veteran tells us they were told they don't need anything besides A and B, they are right. You don't have to get anything else, but if you only have A and B, you will have to pay the complete $185 for Medicare Part B on your own. And there are no other special dental, vision, hearing, gym membership benefits that you will have. But when you add the correct $0 monthly premium Part C plan, you become eligible for the Part B premium refunds and the dental, vision, hearing, and gym memberships that come with it. Uncle Sam sends a set amount to your Part C plan every month when you join Part C. The beauty of this arrangement for veterans is that specific Part C plans will use part of that government funding to reduce your Part B premium, putting real money back into your pocket every month. How does this premium reduction work? The standard Medicare Part B premium in 2025 is $185 per month for most people. When you enroll in a Part C plan offering a premium refund, the plan pays you a portion of that premium. Depending on the specific plan and where you live, this reduction can range from $20 to $185. I use my dad as an example a lot. His Part C plan refunds $150 monthly. That is a little bit more than our average client who receives $110 monthly Part B premium refund. And we don't recommend any plan we wouldn't put our own parents in if you lived in that zip code and county. The refunds available from the Part C plans depend on where you live. The way this refund gets implemented is straightforward. If your Part B premium is being deducted from your Social Security benefit, which is the case for most veterans, you'll see your Social Security check increase by the refund amount. For example, if you're getting a $100 premium refund, instead of $185 being deducted from your Social Security for Medicare, the deduction is only $85 monthly. If you don't receive Social Security benefits yet and pay your Medicare premium directly through quarterly billing, your quarterly bill will be reduced by the monthly reduction amount multiplied by 3. So a $100 monthly reduction would lower your quarterly bill by $300. $185 a month times 3 is $555. Instead of paying $555 quarterly, in this case, you'd only have to pay $255 quarterly. This isn't some temporary promotion or obscure loophole. This established, legitimate benefit has been helping thousands of veterans recover part of their Medicare costs. Our client gets a $110 monthly refund. That's $1,320 back in their pocket every year. Now, I want to address veterans' biggest concerns when I tell them about this opportunity. We hear it almost every day. If I enroll in Part C, won't I lose TRICARE for Life benefits or VA health benefits if I have that too? The answer is absolutely not. This misunderstanding prevents countless veterans from taking advantage of this opportunity to get money back. So let me be absolutely clear. Enrolling in Part C plan does not cause you to lose your TRICARE for Life benefits, nor does it cause you to lose any VA health benefits if you are enrolled in that too. In addition, this has no bearing on any disability rating you have or your ability to increase your disability rating in the future. However, there is something essential to know. Not all Part C plans are created equally when working with TRICARE for Life. You must choose the right plan type to ensure everything coordinates smoothly. The best Part C plans for veterans with TRICARE for Life are generally PPO plans rather than HMO plans. PPO stands for Preferred Provider Organization. These plans have nationwide networks, don't require referrals to see specialists, and include out-of-network coverage. This aligns with how TRICARE for Life is designed to work. TRICARE for Life will pay deductibles, copays, and coinsurance for in- and out-of-network services in the Part C plan. Over 90% of our veteran clients choose PPO plans for this reason. With a PPO plan, you maintain your freedom to choose healthcare providers nationwide. When you go to the doctor and other providers, you show 2 billing cards, your Part C card and your military ID. This means when your provider bills your Part C plan for a bulk of the bill, the provider should bill your TRICARE for Life for the secondary payment. Wisconsin Physician Services administers TRICARE for life. Your military ID doubles as your TRICARE for life medical card when seeing providers or getting prescriptions at private pharmacies. If you're not 65 yet, take a moment and pull out your military ID card. Look at it carefully. Most veterans don't realize it actually contains two different expiration dates, one for your general military benefits and another specifically tied to your TRICARE coverage. On one side, your military ID likely shows indefinite expiration date for your general benefits, but flip it over or look at the other side and you'll notice another expiration date that corresponds precisely with your 65th birthday month. This second expiration date is critically important. It marks when your TRICARE Prime or Select coverage ends and your TRICARE for life eligibility begins. Here's exactly how it works. If you're born on the second day of the month through the last day of the month, your TRICARE for life automatically goes into effect on the first day of your birthday month. For example, if your birthday is June 15th, your military ID would show an expiration date of May 31st, and your TRICARE for life coverage begins on June 1st. There's a special rule for those born on the first day of the month. If that's you, everything happens 1 month earlier. Your TRICARE for life coverage would begin on the first of the month before your birth month. Understanding these dates is crucial for proper planning. Many veterans miss this transition period and don't realize they need to have Medicare Parts A and B in place precisely when their TRICARE for life begins. If there's a gap between when your current TRICARE expires and when your Medicare coverage starts, you could be left with a dangerous coverage gap or face stiff penalties. This is the kind of detailed information that general Medicare advisors simply don't know to tell you. But for us, it's essential knowledge we share with every veteran approaching age 65. This is the kind of detailed information that general Medicare advisors simply don't know to tell you. But for us, it's essential knowledge we share with every veteran approaching age 65. Most Medicare advisors don't tell you this because they are not specialists. They don't tell you that some Part C plans are specifically designed for veterans. These plans recognize that veterans with TRICARE for life can also have VA health benefits and prescription drug benefits from TRICARE for life and VA. So instead of bundling in features you don't need, these veteran-friendly plans focus on providing the highest possible Part B premium refunds and extra benefits that neither Medicare A and B, TRICARE, nor VA covers. These are the critical details that general Medicare advisors typically don't know or don't explain to veterans. And it's why working with specialists who only serve veterans is so important. Let me show you exactly how the right Part C plan works with TRICARE for life in real-world situations and why this combination is so powerful for veterans. The process is simple. You go to a medical provider with a Part C plan and TRICARE for life. You present your Part C card and military ID for the TRICARE for life. The provider bills your Part C plan first, which covers most of the bill. Then the provider bills TRICARE for life for any remaining costs like deductibles, copays, or coinsurance. For example, if you see a specialist who charges a $40 copay under your Part C plan, TRICARE for life pays that $40 copay for you. You pay nothing out of your pocket. If you have a hospital copay of thousands of dollars, TRICARE for life pays it. As I mentioned, virtually nothing comes out of your pocket for the medical services, but there always seems to be that $100 aspirin. I'll quickly hit on some of the additional benefits that can be offered with the Part C plans. This is another thing that they aren't telling you about. Most Part C plans include extra benefits that neither Medicare A and B cover nor TRICARE covers. There's additional dental coverage. Many plans cover your routine exams, x-rays, crowns, fillings, root canals, and more, and sometimes dentures. Now, the dental isn't designed to give you a mouthful of implants, but it is designed to provide the basic needs of your mouth and a little bit more. This is much more than Medicare A and B do when they stand alone, and TRICARE only offers dental care that they have to pay extra for through programs like MetLife Dental, Benefed, Delta Dental, and FedVip. The Part C plans also offer vision benefits, an annual eye exam, and allowances for glasses or contacts. My dad gets his glasses for free from the VA, probably just like you, then uses his Part C vision allowance to get an extra pair because at 81, my dad, he has a tendency to sit on his glasses and lose them. There are also allowances for hearing aids and gym memberships. Many plans include silver sneakers or similar fitness programs at no additional cost, giving you access to thousands of nationwide fitness facilities. There's over-the-counter allowances, and they usually come in the form of quarterly benefits for items like vitamins, supplements, pain relievers, blood pressure monitors, and more. Now, many of our clients have 100% disability with the VA, and I know you already get dental coverage through the VA, but many of our 100% disabled clients use their Part C dental benefits for extra services or more frequent cleanings that the VA doesn't cover. Same goes for prescription drugs. Veterans already have prescription benefits through the VA or TRICARE or both. The Part C plans designed for veterans often don't include Part D drug coverage, recognizing that you already have coverage. This allows the Part C plans to offer higher Part B premium refunds instead. My dad's plan happens to include Part D coverage, and here's how he uses it. He is on 8 generic maintenance medications and is a priority 8 at the VA with copays for medications. But with his Part C plan's drug coverage, 7 of those medications have a $0 copay and 1 has a $5 copay. So he has the VA send the prescription to his local pharmacy where he pays significantly less than his VA copays. These are the real-world benefits that veterans with TRICARE for Life are missing out on because no one is telling them how these programs can work together. The reason they aren't telling veterans is that they are not specialists with veterans. They concentrate on, so to speak, the civilian market where there are millions more potential clients. We choose to focus only on the veteran. Now, I'll explain why this is critically important for veterans to understand. Many veterans with TRICARE and VA healthcare will believe that VA healthcare is enough to satisfy Medicare's requirements. This is a dangerous and costly misconception. What some veterans with TRICARE for Life will tell you is they use the VA only and will delay Medicare Part B until they need to use TRICARE for Life. That is a very costly mistake, and here is why. The truth is that VA healthcare is not considered creditable coverage for Medicare Part B, B for Bravo. If you don't enroll in Part B when Uncle Sam says you should, and later, if you decide to enroll, you'll face a permanent late enrollment penalty. These penalties increase your premium by 10% for each 12-month period you delay enrollment, and they never go away. They're added to your monthly premium for the rest of your life. If you delay Medicare Part B for 5 years because you thought VA coverage was sufficient, you'll be hit with a 50% penalty that you'll pay forever. That means instead of paying $185 a month, you'd pay $277.50 per month, an extra $1,110 yearly for the rest of your life. Then, as the Part B premium goes up every year because the penalty is a percentage and not a fixed amount, your penalty will go up every year as the Part B premium goes up. And the Medicare Part B premium goes up almost every year. The VA itself recommends that veterans enroll in Medicare Parts A and B when they become eligible. They know that VA coverage and Medicare complement each other, giving you more options and flexibility. The Part B premium refund opportunity we're discussing gives you a significant reason to get your Medicare coverage precisely correct. Proper Medicare coverage protects you from penalties, and the correct Part C plan, you will be able to get money back while enhancing your benefits. Another critical aspect of this that most advisors won't tell you about is timing. The decision about which plan to choose isn't just a one-time thing. You can change your coverage annually during Medicare's annual enrollment period from October 15th to December 7th. They're not telling you that Part C plans, including their benefits and premium refund, they change every year. This means the best plan for you this year might not be the best plan next year. I've seen cases where veterans stick with the same Part C plan for years without realizing that better options have become available. One Army veteran I worked with had been in the same plan for 5 years. When we reviewed his options, we found a new plan that offered $100 higher premium refund and better dental coverage. By switching plans during the annual enrollment, he increased his annual refund and got better overall benefits. The bottom line is this: with the right Part C plan, you maintain your freedom of choice in healthcare providers, gain valuable additional benefits, get Medicare back on your Part B premium, and ensure that your TRICARE for Life continues to work precisely as it should. Let me summarize the truth about TRICARE for Life and Part C that no one is telling you. You must have at least Medicare Parts A and B to keep your TRICARE for Life benefits. Certain Part C plans will refund part or all of your Part B premium each month. TRICARE for Life works with the right Part C plans. You don't lose any benefits, you only gain benefits. TRICARE for Life still pays all your deductibles, copays, and coinsurance of Medicare Part C plans. You can gain additional dental, vision, and hearing benefits that Medicare A and B don't cover and TRICARE for Life doesn't cover. The Medicare landscape changes yearly, so reviewing your options annually is essential to maximize your benefits. This is why many of our veteran clients are switching to these plans. They keep all their TRICARE benefits while getting money back and additional coverage. Here's your next step. If you're turning 65 in the next 12 months or already have TRICARE for Life and are paying for the Medicare Part B premium, we need to look for the Part C plan that provides the highest refund for you. The process is simple. When you call us, we'll ask you a few basic questions about where you live and what benefits are most important to you. Then we'll research the available plans in your area and identify those that offer premium refunds and meet your specific needs. If you decide to enroll, we'll guide you through the entire process. It can all be done on your phone in a single phone call or through your computer. There's no cost for our service. Medicare makes it so all of our services are free for veterans. We get paid by the Part C plans when we help you enroll, and all plans pay us the same amount, so there's no incentive to recommend one over another. And because we specialize in working with veterans only, we understand the unique considerations affecting your Medicare and TRICARE benefits. We know which plans work best with TRICARE for Life and which offer the highest premium refunds in your area. Call us today at 888-960-VETS. That's 888-960-8387. Remember, we specialize in working with veterans because we speak veteran. We understand your unique needs and are committed to helping you maximize your benefits. We owe a debt of gratitude to you for your time and service. Now let us serve you by helping you get the most from your Medicare and TRICARE benefits. Want to learn more? Click on one of the videos below to dive deeper into refunds and VA and TRICARE benefits. If this video helps you understand your benefits better, hit the subscribe button to stay updated with the latest tips for veterans. We're also here to help you get the most from your benefits. Thanks for watching, and remember, we speak veteran.